My name is Brandon Burk. I am a registered respiratory therapist from Springfield, Missouri. I'm currently the Director of Clinical Education for Respiratory Therapy Program at Ozarks Technical Community College. Consider the catheter size that you're using for the size of endotracheal tube or tracheostomy tube that you have in place in the patient. So the general guidelines should be that we use a catheter that occludes less than 50% of the inner lumen of the endotracheal tube. A good guideline to follow on that is to take the inner diameter of the endotracheal tube and multiply it by 2, and then use the next smallest size catheter. So for example, if I had a patient that was intubated with a 7.5 inner diameter endotracheal tube, I would multiply that by 2, so that would be 15, and then I would use the next smallest size. So a 14 French catheter would be acceptable for a 7.5 tube. But as you go smaller down in tube size, for example, if I had a patient intubated with a 7.0 endotracheal tube, a 14 French catheter would be too large in diameter, so I would need to use the next smallest size, which is a 12 French. And just a note, suction catheter sizes in French go up by 2, so you would use 14 French, 12 French, 10 French, and so on as you go down the line. But for an adult, we should always remember to use a catheter that is less than 50% of the inner diameter of the endotracheal tube. So as you can see from the table, there are recommendations for endotracheal tube size and suction catheter size that would correspond with that. So you can see for a 7.5 tube and up, a 14 French catheter is acceptable. However, as you go to a 7 or a 6.5, a 12 French would be appropriate, and for a 6 or a 5.5 tube, a 10 French catheter would be appropriate. I hope that you find this information useful in your own practice. Please contact me anytime with any questions you might have. I'd be happy to hear from you. Thanks.